and thank you so much for taking time out of your busy day to join me. My name is Carla, and I am the Director of Education and Partnerships at NeedyMeds, and it is my pleasure to have the opportunity to introduce all of you passionate staff members and volunteers of the Council on Aging of Southern California. So thanks again. So today I'm going to cover what NeedyMeds is, the educational and healthcare cost savings resources we offer, how to navigate our website, and how this information will hopefully help you to serve the population you work with. So a few things before we get started, hopefully which will help you make the most out of today's presentation. So you can feel free to ask questions at any time. And Tamiko, you could do this by typing them into the questions section to me, or you can feel free to interrupt me audibly and ask any questions you may have. And of course, I will take breaks to give you guys an opportunity to ask questions. And of course, if I don't get the chance to answer any questions, I'll be in touch after the webinar. I will provide my contact information and the contact information for NeedyMeds as well. You can find a copy of the slide deck in the handout section of that GoToWebinar control panel. But of course, Tamiko, I'll email that to you in case anybody would like to hang on to it or use it for a reference moving forward. And we're also recording this webinar so that you can refer back to it, and so we can share it with those that weren't able to attend. And just a heads up, that will take us a couple of days to do because we try and make it as pretty as possible. For example, we'll cut out all of my audio checks in the beginning. So with that, let's get started with what NeedyMeds is. What you're looking at is our mission statement, our vision statement, and a statement about how we achieve our mission. So that's all our fancy language, but simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. Since you guys are on the West Coast, I do want to remind you that we're on the East Coast. Keep that in mind when you're referring people to NeedyMeds, and we are open Eastern Time, 9 a.m. to 5 p.m. Monday through Friday. So this slide shows the most popular and effective cost savings sections on our website that we'll be reviewing during today's presentation. So we're going to talk about these sections and find out how to locate them on the NeedyMeds website. So with that, I'm going to go right to the NeedyMeds site. And just a couple of things to keep in mind. Today, we're going to spend pretty much all of our time under this Patient Savings tab, which is where you can find all of our healthcare cost savings resources. But there are other resources. As you can see, it's pretty chock full, this website. So I hope that you take the time to explore it further. A couple of things I do want to point out. On the left-hand side, we now host BeMedWise. And BeMedWise website has up-to-date and accurate information on promoting the safe use of medicines. So just check out all the helpful information, in particular under the Use Medicine Safely tab. I wanted to point that out to you. And I also want to point out our Advocates tab. This is where you'll find a lot of easy ways to stay up to date on healthcare cost savings programs and timely healthcare topics. And I'm going to point out a few of these resources at the end of the presentation. And we literally just added a new resource called MedAdvisor, and you see it's taking up some room on our home page. MedAdvisor is a site where you can receive free, relevant diagnosis-related information about clinical trials, treatment options, and research findings. What this means is that you can spend less time searching the internet for information on medical conditions. All you do is sign up by clicking the Yes button, and information relevant to your diagnosis will come straight to your inbox. So that's just a little bit of an FYI. But today, as I said, we're going to spend time under that Patient Savings tab, which is on the top left-hand side. And we're going to get started with how to save money on name brand medications, which is with our Prescription Assistance Programs database. And you can find a whole section dedicated to prescription assistance programs on that top left-hand side. And many of you may be familiar with these, and how we define them are that they were programs that are usually supported by pharmaceutical companies and most of the time offer free and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. And of course, not every drug will have a prescription assistance program, and when one is available, eligibility requirements and applications will vary from program to program. One common requirement is the patient's doctor usually needs to be involved by providing a prescription, signing the application, and submitting the documentation. And as you can see, there are a number of ways you can search. You can search probably by the least common company or program name, but you can also search by the brand name drug. That's a hyperlink. So let's say we're doing a search for a brand name drug called Lipitor. I click on that brand name drug hyperlink, and the first thing that happens are a bunch of icons pop up. And what these icons do is they show you what type of information or cost savings program is available for that drug. Is there a prescription assistance program available or a coupon? Are there support pages or drug videos that provide more information about that medication? And this week, we also just added this eye icon, this blue circle with that italicized eye, which I'm sure you've seen on other sites, and pretty much always means more information. In this case, it refers to more information about the medication, and it will take you directly to a drugs.com page that'll have additional information about the drug or product. I'll also point out, to make searches easier, you'll see an easy A to Z index. So let's say we're doing that, returning to that search for Lipitor. Obviously, I'll choose the letter L in the A to Z index, and then I'll scroll down to see Lipitor and the long list of medications. If you see your medication listed more than once, that usually means it's available in a different formulation. So what I suggest is click any of those hyperlinks with your drug name. Now a bunch of those icons pop up. The eye indicates there's more information, taking you to the drugs.com. The one in the middle says that there's support pages available. And the icon on the left, and don't tell my boss this because I think it looks like a broken old cell phone. It's supposed to look like a pill, but that's the conversation for another day. So that's a hyperlink, which means that there is at least one prescription assistance program available. So I'm going to go ahead and click on that page. And then you see right at the top in that blue bar, program 1 of 3. That means that there are currently 3 prescription assistance programs available. And the reason I say currently is because, as you would imagine, it changes all the time. So that's one thing I do want to stress as well, that if you check out our website and we don't have a program, a cost savings program available for a particular drug or medication, please do visit the website again or call our counselors at a later time to see if we have any updates, because we pride ourselves on regularly updating our information. So I'm going to make the screen a little bit smaller. Don't worry right now about reading that text. I just want you to see what a snapshot of this prescription assistance program looks like. And hopefully you'll agree there's all the information that you need. One thing I do want to say is we're always updating our website. I'm actually charged with perfecting the usability of our website. So professionals, volunteers, staff members such as yourselves that are on the front lines working directly with people in need of our services, we really need and welcome your feedback. So please do be vocal about your experience on our website. So let's talk about what's on your screen right now. At the top, you will always find the name of the supporting organization and the contact information. And that's really important because if you have any questions about the program, you're going to want to reach out to the program directly as opposed to calling NeedyMeds. Underneath that, you'll find the program application section, which pretty much always has a direct link to an active PDF, which can be completed online and printed out. The medication section tells you exactly what it sounds like, the medication that this prescription assistance program covers. And then really importantly, you will find the eligibility requirements section. Now, although I said eligibility requirements will vary from program to program, it's almost always based on three factors: insurance coverage, income, and residency. So I want to just say a few things about those particular requirements. One thing is, when I started working at NeedyMeds, I really thought that all of these programs, in particular prescription assistance programs, would only be for people that didn't have insurance or drug coverage. Now, certainly that's often the case, but as you can see, if I've highlighted in this instance, that's not always the case. So don't make the wrong assumption like I did, that if you're helping somebody that has insurance or drug coverage, they're not going to qualify, because that's not always the case. Eligibility requirements pretty much always take into consideration the person's income level. And the income is often based on a certain multiple of the federal poverty guideline. So we put a federal poverty guideline calculator right here. So let me show you how easy it is. Let's say we have an individual, and you can see I use this example often, that makes $85,000 a year. Well, first of all, I'm jealous because that's nowhere near what I make, but that's a conversation again for another time. So let's say you type in that information. One of the things you may have noticed, I only typed in the digits. You want to make sure not to put any periods, commas, or dollar signs. And that income that you type in is the same information somebody would put on their tax return information at the end of the year. So this person makes $85,000 a year, and let's say they're supporting a family of 3. You hit calculate, and the yearly income is indicated as 398% of the federal poverty guidelines. Now, if I click back to the eligibility requirements section, you can see that this individual clearly qualifies, which is the best case scenario. But what happens if the calculation showed that this individual was not eligible? Maybe he found himself just above the eligibility requirements at 405 or 410%. Well, when that happens, don't despair. If the individual's income is slightly over the limit, we recommend applying anyway and ask the program to make what's called an economic hardship exception. And if that point the individual is still denied, you can always appeal. The other thing I want to talk about is if you work with a population that is undocumented, again, don't assume that they won't be eligible. Make sure to check out the residency requirements, where we will provide the detailed information for each program. Oftentimes it will say things like must reside in the U.S., and that's really all it means. It means the person must be living or being treated by a healthcare professional in the country. Underneath that, you'll find the application section, which is important because this will tell you details about the application process, including if or how the doctor needs to be involved, and the time frame, for example, which the decision will be made. And that's really important because you never want to put your client in a position of missing their medication. Next, you'll find the medication section, which has details such as where the medications will be sent to and the details for reapplying. Always be sure to check out the additional information section, because that's going to provide other pertinent information that doesn't fall neatly into the other categories. And before I move on to one other quick thing about prescription assistance programs, I want to take a moment to see if anybody has any questions. Oh, and actually, yes, and before I get to the questions, one thing that I almost neglected to mention is, because you may be working with the population that are recipients of Medicare, we also have in the eligibility requirements section whether or not the individual will be eligible if they are Part D recipients. And that's really important, and I almost forgot to mention that. So do be mindful of that. So thanks, and getting to your questions now.
Okay, so they can be on a state or federal program then?
So here's the answer to that, which I hate giving, which is it varies from program to program. But the good news is you will be able to see that in the eligibility requirements section. So one thing I want to say about the eligibility requirements section that I find particularly helpful with NeedyMeds and the way we share information if you, let's say we have somebody that's looking for help affording Lipitor. They go to a website and they call our counselors and say, yeah, we've got 3 programs available. And then it turns out we give them the 800 number and they're not eligible for any of them. That is a waste of everybody's time and also frustrating. So that's why we're sure to put the eligibility requirements section here, because we don't want to refer people to programs that we know right off the bat aren't eligible. And I also want to stress in the top, you will see where my mouse is hovering, our 800 number. We do have Spanish-speaking counselors, so if you're working with clients that you don't necessarily have the time to search the website with them, or they don't have access to the internet or computer, or they don't feel comfortable doing this search, our expert call center counselors can do all of this work for you over the phone. Okay, any other questions other than whether or not people are eligible for Part D can apply?
Do they have to meet all of that criteria, or just a few
So
under eligibility?
and this is, I hate saying this, but again, it does vary from program to program. For example, sometimes people will ask you what your income is, and they'll leave it at that. Sometimes they want qualifying documentation. So it will vary from program to program, not only whether or not the individual is eligible, whether or not there's particular criteria under that they have to meet, and whether or not that needs to be documented. That will all vary from program to program. And that's one of the reasons we always put the contact information for the program there. But those are great questions. Anything else? Okay, and feel free again to interrupt me as we move along. And before we move past prescription assistance programs, I do want to point out under that patient savings tab, we do have a section dedicated to help with prescription assistance applications. So sometimes applying for these programs can feel complicated to people that aren't familiar with it. So we've put together a directory that lists nonprofits that will help people apply to these programs, usually for free or for a very small fee. And as you can see, you can search in your area by zip code or by state. Please be vocal if you're not finding any program in your area that is helpful, because we will charge our research team with attempting to update that database. And also, if you're aware of a program that we haven't included here, please let us know. One of the questions we do get often is, do NeedyMeds call center counselors help people apply for prescription assistance programs? So unfortunately, the answer to that today is we do not, but that may be changing in the future. So stay tuned and do check back with us. So returning to that patient savings tab, on the top left-hand side, we just talked about brand name. You'll notice a hyperlink for the $4 generic discount drug program. And this is exactly what it sounds like. It's a directory of all discount programs for generic medications available at major retailers. Now, although it's called the $4 generic discount drug program, most will range in price from between $4 to up to $15 for a 30, 60, or 90-day supply. Like the other databases, there's a number of ways you can search. You can search geographically by state. You can search to see what store or pharmacy are participating, or you can see if there's a particular drug that is included in this $4 generic discount drug program. So for purposes of this webinar, I'm going to do a broad state search. So let's see what's available in your state. So in California, there are currently 7 stores or pharmacies participating in the $4 generic discount drug program. And as you can see, it includes a lot of the national chains such as Rite Aid, Walgreens, and Walmart, but it also includes more local or regional stores. For example, these names are not familiar to me. And hopefully, again, you'll agree that there's a snapshot of the most pertinent information, including the store name and a hyperlink, the program name, and most importantly, the program column on the far right-hand side. That'll let you know exactly what this program is going to let you save. And as you can see, like I said, a lot of times it usually ranges from $4 to up to $15 for a 60 or 90-day supply. but sometimes it's more expensive, as you can see, and sometimes they actually estimate the savings with a percentage as opposed to a dollar amount. So moving along, and again, I'll please don't hesitate to interrupt me if you have any questions. So I'm going to keep motoring along and let my mouse hover over that patient savings tab. And one of the things I want to point out to you is a pretty popular destination on the NeedyMeds website, which is our free, low-cost, or sliding scales clinic database. Last year, we actually updated this database to be broken down into 4 categories: medical clinics, dental clinics, mental health, and substance addiction clinics. I'm going to use the medical clinics category for purposes of just showcasing what's available, but all the 3 other clinics databases are set up exactly the same way. So let me go ahead and click on that, and as you can see, it's a pretty large section. We have just under 17,000 clinics in this category, and you can search a number of ways. You can search really narrowly by clinics close to the person's home or work, for example. You can search by zip code, or you can search broadly by state. So let's do a zip code search. And I'm going to do a pretty broad one, see what's available within 10 miles of the 92614 zip code. Let's say the individual does have transportation or has access to transportation. So the results yield that there are 22 free low-cost or sliding scale clinics in the 92614 area code. So oftentimes, I didn't used to always point out this clinics database, because if I'm helping people where the population they help usually has a primary care physician or access to one, I would think, well, why bother pointing this out? And then I realized it really is helpful to point it out. First of all, certainly being aware of dental clinics, mental health clinics, and substance addiction clinics in your area can be invaluable. But the other thing is, people's access to insurance changes all the time. Their doctor's office may close or relocate. And also, it's really good to be aware of clinics in your area. Sometimes people find themselves in a situation, such as I did, for example, that it wasn't really an emergency, but it was a Friday night, and I couldn't wait to Monday to go to my doctor. So I wound up going to the emergency room, which cost me a ton of money. I didn't know there was a clinic in my area with extended hours. So it not only would have been a lot more convenient and faster, but it would have been a lot cheaper. So this is really good to share with your clients. And you can do that by printing out, clicking on this print hyperlink, and do just that, the print all hyperlink, and print out all 22 of these clinics. Or you can check the ones only your patient or client may be interested in and choose the print option instead, which will do just that. It'll generate and print a list of only the ones you think the individual will be interested in. And like the other sections, all of the pertinent information, or at least I hope you agree, are on your screen right now, including the name of the clinic, their contact information, and a hyperlink. The eligibility, meaning who can be seen at this clinic. It'll let you know if Medicare or Medicaid patients, for example, are eligible to visit this location. And important things such as, can the patient expect to incur a fee, and does the staff there speak other languages? The right-hand column lets you know further details, such as the services that are provided and the hours that they're open. Although we pride ourselves on the information being accurate and up-to-date, we recommend that you give the clinic a call or visit the website if you're interested in really specific and confirming specific information, such as the languages the staff speaks, how much the person should expect to pay, and when, in fact, are they open. So do keep that database in mind. And before I move on, returning to that patient savings tab, are there any questions about that database or other things I've covered so far? Okay, great. So under that patient savings tab, another section that you're going to be interested in is our coupons, rebates, and more on the bottom left-hand side. So one of the things, just so you know, we're working on is eliminating a bunch of this text to make it a little bit easier to read. So this database is exactly what it sounds like. It's where you can find prescriptions or over-the-counter medications or supplies for which there is a coupon, a rebate, a savings offer, a free trial, or a free sample. You can search for the product or drug a number of ways. You can search by the name of the drug, by the name of the product, or by the category, which in this case means medical category. So when I click on that hyperlink, you'll see a long alphabetized list of medical categories pop up. So I'm going to go ahead and just let's click on allergies, because that's what's on my mind, because my nose is running and my eyes are itching because it's August. So there are those icons again. And that's really helpful, because if you were looking for help to affording a drug or a product, this database will also let you know if other cost savings or information is available. And then as you scroll down, you will see what the listings look like. One of the things that I want to let you know, we did update this section of our website. It used to only be a paragraph of information, which was kind of difficult to read. So instead, we broke it down into bullet points, which is a little bit easier. We also now always include a direct link to the manufacturer's offer and a little section right here where you can have the NeedyMeds drug discount card. You can print it out, we can email it to you, or we can text it to you. And as you imagine, I'm going to talk about the NeedyMeds drug discount card a little bit further along in our presentation. And like the prescription assistance programs database, again, there are those icons letting you know there's more information with drugs.com, support pages, which provide additional hyperlinks. And the one on the left means that there is a prescription assistance program available. As I said in the beginning, and I want to stress, maybe I didn't say it, so it's a good time to make sure I do, prescription assistance programs always offer the most cost savings option. So if you happen to stumble upon a coupon on our website for a particular drug and you see that prescription assistance program icon, first be sure, check out whether or not your client is eligible for a prescription assistance program, because you're always going to want to have them apply to that. If not, you can always try and find out or use the coupon. And the answer that we get a lot is, what if there is more than one prescription assistance program, or there's more than one cost savings program? There's a prescription assistance program and a coupon. The answer is apply for and print out anything and everything you can to make sure you're covering all your bases. Now, aside from the prescription assistance programs database, the second greatest source of savings is through our diagnosis-based assistance program database, and that's under patient savings, under that middle section. Now, this section is a little bit different because for the most part, it doesn't include medicine. What it includes instead are other expenses in addition to medicine. For example, maybe somebody needs help affording medical supplies, durable medical equipment, things like testing supplies, or maybe they need help affording something like a wig or house cleaning services or assistive technology. You can search a number of ways. You can search really specifically by the disease, state, and service. You can search probably by the least common program name. You can search geographically by state or nationwide. And what that means is there are programs available in every state that you have to reside in that state to be eligible. Or there are nationwide programs, which mean that regardless where your client lives, they're eligible to apply. And you can also search by diagnosis. So I'm going to go ahead and click on that hyperlink for diagnosis. And there's that A to Z index again. And I'm going to click on the letter D for diabetes. And I really like to use diabetes as an example, not only because it's so common in our country, but it's a great example of a diagnosis that really requires quite a bit of expense in addition to medication. Because it's a broad category, it's broken down into a bunch of subcategories. But I'm going to go ahead and click on the general hyperlink for diabetes. And as you can see, there are currently 71 diagnosis-based assistance programs for diabetes. Like the other sections, there's a snapshot of the most pertinent information, including the program name and a hyperlink, the summary, and the far to right columns are what you're going to be most interested in. What does this program provide, indicated by services provided? And what is the area of service, meaning where does the patient or client need to reside to be eligible? Now, as you can see, oftentimes services include medical supplies or medical equipment, but it varies greatly. For example, this one offers respite care. This one offers access to getting a service animal. So it will vary from program to program. And the far right column, you can see national over and over. That's because we list all of the national programs first, meaning regardless of where the client is, they can apply in our country. And then we list the programs available by state. And there actually are a bunch in California. So let me scroll down. So those are the ones you're also going to be interested in. Now, does anybody have any questions about the diagnosis-based assistance program section? Well, since we're on the topic of diagnosis-based assistance programs, I want to point out under that patient savings tab, diagnosis information pages. And these are exactly what they sound like. They are informational or educational pages dedicated to specific diagnoses. Our goal is to partner with other reputable nonprofits to provide the most comprehensive information about a particular diagnosis. And as you can see, the diagnoses are listed alphabetically. So let me just show you what it looks like, for example. Click on celiac disease. Sponsored by Beyond Celiac, we have up-to-date information, description of the diagnosis. We have resources in that box on the right-hand side. And then we have additional resources at the bottom. And we also, as you can see, check out the breast cancer page, we also list medications that are commonly used in the treatment of that diagnosis. And that's helpful because all you have to do is click on any of these hyperlinked medications and it'll let you know whether or not there is a cost savings program available. So I'm going to make the screen a bit smaller because we're going to return to that patient savings tab, and I'm just going to point out the other databases under this section. I don't want to painstakingly go through every section because hopefully you're starting to see that they're all set up similarly. But we do have a section dedicated to medical transportation. That was updated at the end of 2018, or rather added at the end of 2018, because oftentimes getting to and from a doctor or specialized facility can present an obstacle. We also have databases dedicated to retreats, camps, recreational programs, and scholarships. And the government program section is another great resource, especially if you're working with Medicare or Medicaid beneficiaries. Of course, you can see all the state-sponsored programs, but you can also find pretty exhaustive information on Medicare and Medicaid sites, as well as all of the SHIP or SHINE, the federally funded health advisory programs, and you guys should be listed there. And we also, because eligibility for state programs are often based on income, we have a convenient link to determine federal poverty guidelines and a quick way to request a tax return form. So I'm going to bounce out of the NeedyMeds website and return to my PowerPoint presentation so I can talk to you about another important way to save, which is with the NeedyMeds drug discount card. And before I do that, I'm going to take just a quick break to see if anybody has any questions about what we covered so far.
How did you get to the MedAdvisor link?
I'm sorry?
How did you get to the MedAdvisor?
Oh, that's a great question. So actually, let me show you. So I'm returning to our website. So we're literally just we just added MedAdvisor this week. So there's going to be a few ways you can get to it. Right now, you can get to it right on the cover of our page by clicking on the MedAdvisor icon. Okay, so that will be easy for now. But then moving forward, You will also be able to find MedAdvisor under any category where you can search by diagnosis. So, for example, if you're under diagnosis-based assistance programs, we're going to have a link to that right here. But for now, you can get to it right on our homepage. It will remain in this, what we call the announcement section on the top, and it will also, for a while, live right beneath it in this, what we call, these are the sliders. So it may scroll down a little bit, but for the foreseeable future, you'll be able to get to MedAdvisor from the homepage. Thanks for asking, and we're really excited about that partnership. This is going to provide really important information to our users. Any other questions? So let's talk about the NeedyMeds drug discount card. And I'm sure you've all heard of drug discount cards. They're cards. Sometimes it's a plastic card that looks like a credit card. Sometimes it's a piece of paper. And sometimes it's an app on your phone. And it's a way for people to save money with prescription products or drugs. Now, the NeedyMeds drug discount card differs from other drug discount cards because it's free, it's anonymous, there is no registration, no enrollment, no residency, and no activation required. Users can save between 0 and up to 80% off the cash price of prescriptions, over-the-counter medications and supplies, as long as they're written as prescriptions, and even pet prescriptions if they're picked up at the People Pharmacy. Do keep in mind that not every product is discounted. That's why I always say people can save between 0 and up to 80%, because sometimes the drug discount card won't offer you a savings. I can tell you that our most recent statistics show us that the card offers a savings 85% of the time it is presented to the pharmacist, and that savings is usually about half off of the cash price. So the big question is, who can use the drug discount card? And the simple answer is anyone. If the individual doesn't have insurance or drug coverage, they can use the drug discount card anytime. If they do have insurance, they may choose to use the card instead. And maybe they'll want to do that because their medication is not covered under their insurance. Maybe their copayment is too high. Maybe their deductible is too high. Maybe they find themselves in a coverage gap. Or maybe they've exceeded a cap for drug coverage for the year. One quick note about the donut hole. The money the user spends will not count towards getting them out of the donut hole. That's really important. So let's say you have a client and it's January or February, it's the beginning of the year, and they have a chance of getting out of the donut hole. Don't use the drug discount card to save money, because they're working to get out of the donut hole. If it's the end of the year, if it's November, December, and they're not getting out of that donut hole, they might as well use the NeedyMeds drug discount card to save on their medications. And another new update is that you can also use the NeedyMeds drug discount card to save 40% off the list price of durable medical equipment. And that includes products such as diabetic supplies like needles, testing strips, and meters, splints and braces for your ankle, knee, neck, and back, for example, catheters and incontinence supplies, bath safety supplies like commodes and grab bars, mobility devices such as canes, crutches, walkers, and wheelchairs, and footwear like inserts, and so much more. You simply go to dmemyvirtualdoctor.com, click on the Shop Now button to browse the selection of durable medical equipment, or you can search by product category. At checkout, you enter the ID code on the NeedyMeds drug discount card and click Apply Code. It's as easy as that. So let's return to the website so I can show you how to get your NeedyMeds drug discount card. And while I do, I'll ask if anybody has any questions about our drug discount card.
I have a question. So
Sure.
I think you answered it, but the thing that I was thinking it could be used for is I recently had 3 people that have come in that have cancer, and their drugs are like $15,000 a month.
Yeah.
And so they're in the donut hole the first month of the year, and they would not be, but $15,000 is like, they can't even afford 1 month.
No, that's obscene.
So my question is, they don't qualify most of the time for anything because they're on Medicare.
Mhm.
Would I refer them to the program, or wouldn't I? Because if they could get the money, they would be out of the donut hole very next month.
Right.
Or
Right. So
Yes,
yeah, that's a tricky one. So here's what I would say. One of the very first things you're going to want to do is see if there is a prescription assistance program, coupon, or diagnosis based assistance program that will help that individual. And again, here's what I can recommend. Certainly check out the website or call our expert call center counselors, because they can often, not only are they so familiar and can exhaust the options on our website, but sometimes they come up with creative ways that I wouldn't have thought of. So that's the very first step, is to see if there's any program that the individual is eligible for. Barring that, certainly the next step is to speak with the doctor or the treating oncologist to see if there is another version of that medication. Now, the chances are probably not, but it's absolutely worth making that inquiry, because there may be another name brand, probably not a generic version, but there may be another comparable drug that either is less expensive or there is a prescription assistance program available for that. The final step, as you guessed, would be taking the NeedyMeds drug discount card to the pharmacy and see if that's a savings. And one thing I'm going to review in just a moment is, before the individual heads out the door, we'll be able to let that person know where the drug discount card is accepted in their area, at what pharmacy, and how much is that drug going to cost them using the drug discount card. Because that's really important. I don't want somebody to give me a drug discount card and then I'm running all over my city going from, I can't handle that. So we can do all of that work for them. But whether or not they're going to use it to just bang out that few $1,000s, pay that ungodly amount in the beginning of the year and just get them out of the donut hole, unfortunately, there's a lot of other variables that's going to factor into that decision for that individual. Our counselors can help with the exhausting any cost savings options, but those are the steps I would recommend to take. The other thing that I do want to stress is the pharmacists used to have what's called a gag rule, that they couldn't voluntarily offer information about cost savings program. That gag rule has been lifted within, I think, the last year or the last 6 or 8 months. But it doesn't prevent people anyway from asking a pharmacist about cost savings programs. I do find that people don't count pharmacists as part of their healthcare team, and sometimes pharmacists are really knowledgeable. So even on cost savings programs. So although, of course, NeedyMeds, we pride ourselves on being the go-to source for cost savings programs, we also pride ourselves on educating people how to advocate for themselves. And that comes down to asking the pharmacist, do you have any cost savings programs? Do you have a different drug discount card behind the counter that you can compare for me? Do you have any suggestions? So those are just some ways to attempt to help this individual. I hope that helps.
Yes, it does. Thank you.
My pleasure. So if you did want to obtain a drug discount card, obviously you or your client can call our 800 number. They will drop one or a bunch in the mail to you or your client directly. Under that patient savings tab, there's a bunch of destinations that will take you to our drug discount card page on the top left-hand side. Under prescription assistance, there's a link for it. On the bottom right-hand side, there's a link for it. And also on our home page, on the right-hand side, you'll see a red arrow in a box that says Get Your NeedyMeds Drug Discount Card. And here's a bunch of ways you can get it. You can print out the downloadable PDF, being sure to clip out the card on top. You can fill out this order form, being sure to choose a design. Probably the least convenient, but also an option, is by mailing us a self-addressed stamped envelope. And of course, again, you can reach out to our counselors at the 1-800 number. Now, let's say the individual now has the drug discount card. The next step is knowing what pharmacies in their area accept it. And the chances are there's going to be at least one, if not more than one, because the NeedyMeds drug discount card is accepted at more than 67,000 pharmacies. So all you would have to do is scroll down to this pharmacy search. And let's see what pharmacies are in your area. So bear with me while I check that out. So what's a zip code in your area? Is that one right there? Because I must have been playing around before. So let's do 5 miles with the 94974 zip code. So there are 22 pharmacies within 5 miles of that zip code, and there's all the information you need, the name of the participating pharmacy, the phone number. There's even a map to show you exactly where it is, and there's a print all option, so you can print out the entire list of pharmacies in that individual's area. And again, if the individual doesn't have access to the internet or a computer, our call center counselors can do this work for them. So now in this scenario, the individual has the drug discount card. They know what pharmacies accept the drug discount card, and the final step is clicking on this drug pricing calculator box on the left-hand side. This will let you know how much the drug will cost using the NeedyMeds drug discount card. Couple of things I want to mention. To find that out, you need 4 pieces of information: the name of the drug, the day supply, the day supply, the amount. Is it a 30, 60, or 90-day supply, for example? Did I say the dosage? As well as the zip code of where the individual is going to pick up that medication. So couple of disclaimers I want to say. One thing, drug prices change from month to month. So don't go and don't find out what the price is and go pick it up a month later, because it will probably change. Will it change dramatically? Sometimes. So it's worth checking it out right before the individual is going to head out to pick it up. And the other thing I want to stress is that the NeedyMeds drug discount card pricing tool, it provides an estimate. Now, although it's a close estimate, it is not accurate down to the date, the dollar, to the penny. The reason I say that is because a few months ago, I suggested that my mom use the drug discount card, and she saved an enormous amount of money. It worked out beautifully, but I think it was like 5 cents off, and she still brings it up. She still, to this day, she just mentioned it the other day, that I told her the price I gave her was wrong. So now I always make sure to say, although it is an estimate, although it's a very close estimate, it is still an estimate. And one other thing I do want to mention before I get off the NeedyMeds drug discount card, on the left-hand side, you will see a box dedicated to the NeedyMeds Storyline app. And the Storyline app is a free self-care app that makes it really easy for individuals to track and manage not only their health conditions, but as well as the health conditions of their loved ones. And as you can see here, it has customized self-care tools. It's a medication reminder, a symptom tracker, all of those bullet points you can read. You can get this for free on Google Play, the iTunes App Store as well. And the reason I'm mentioning this now is because it does have the NeedyMeds drug discount card built into it. So I'm going to exit. Does anybody have any questions about the NeedyMeds drug discount card? Because as I exit out of there, I'd be happy to answer any other questions that come up. So I wanted to put up this additional resources section. In the beginning, I mentioned that we were going to spend the most of the webinar under that patient savings tab. Right next to that is the additional resources tab. Please do check that out, because there's probably resources, I think, since you are boots on the ground, dealing with your community, working with people one-on-one, these additional resources may be useful to you. At the bottom, you'll see we have tons of brochures and educational materials. Please let us know if you'd like to receive a bulk supply or just a sample. They're not helping anybody just sitting on the shelves here at NeedyMeds. At the beginning of the year, we also updated our monthly newsletter called Vitals, and I think there's about 26,000 people that have signed up for it, so we hope that you join us for that. You can also sign up for our email alerts, letting you know when there's changes to our programs on our website. We pride ourselves on populating our calendar of events, which is on the bottom right hand of our homepage with webinars, so please do join us. And last but not least, we do have a drug discount partnership. And Tamiko, I'll probably follow up with you about this. What that means is we can create for free a plastic drug discount card with your organization's name and logo, and that's free of charge. And when we do that, you will also receive a complimentary monthly report letting you know how many times your drug discount card is used and the dollar amount of savings. So I'll send you a follow-up email about that because I don't want to take up too much of your time. And as of course, and as promised, I wanted to leave up my contact information if you have any questions. I put up my contact information for my colleague Alana because if you are interested in receiving drug discount cards or brochures, you can reach out to her directly. And I try and fit in our toll-free number as many times as possible. So there's our toll-free helpline phone number at the bottom of the screen that I do hope you share with the population you serve. So does anybody have any questions before I wrap up? I hope that silence means that I covered every question you could possibly think of, but if not, please don't hesitate to call our counselors or certainly reach out to me directly. Tamiko, what I'll do is I'll send you that follow-up email with the link that I promised, as well as a PDF of this PowerPoint presentation. And when this has been converted into a video, I will happily email you the link for that, which usually takes us about a couple of days.
All right, that sounds great. Thank you.
Thank you so much, everybody, for taking time out of your day to learn more about NeedyMeds, and we really do hope you stay in touch. Have a great afternoon. Take care.
Thank you.